shall we go ahead with Pooja? Do you want to try for me, because I've not heard you before? Do you want to try doing a station? I want to hear how you perform. And then Falak, you can try as well. And, you know, anyone can try later on. Shall I ask? I'm saying to Pooja because Pooja said something on one of the one of our communications, and I wanted to see how she's doing. If everyone else is okay with that, yeah.
May I know the station? That would be great.
I can tell you the station. Will everyone be okay that I am asking rather than? So yeah, okay. So Falak wants to do as well. Good, okay. Just a minute. So that will be syphilis. Do you want to do that?
No, please no. No, please no.
You should try. You should try. Yeah, I can give you 5 minutes to go through syphilis first. And then
give me anything but the syphilis. This is the only station which I was not knowing in my November exam. I still regret.
So you would have seen things after that.
Yeah. No, I was so much on depression that I can't tell you what a horrible station that was for me. She was not ready to listen even
anyone
a
wanting
word.
Anyone wanting to do this one? Falak, you want to do? Okay, syphilis.
I can try.
Yeah. Okay. Okay. Let me give you the station, and I'll give you the.
I haven't read, but I just want to try without reading, just like.
So Usha wants to try as well.
Yeah, I just want to give it a go.
Let's give this to Falak. She raised her hand first.
Okay. Yeah.
And then Usha. Okay.
Oh my God, that it will be competition.
Yeah, we'll always do like that, isn't it? We'll always do like that.
Okay.
Can I try one, Dr. Sam, please?
Let's see. Yeah, sure. Let's see first. Let Falak do, and then. Where is it? Where is my? So let's start with Falak. What I'm trying to bring up is the timer. Let me give you another window for timer. So new window. You have 5 minutes to look into the syphilis, whatever you want to quickly see. Okay, I don't mind that. I want to see the correct approach. Okay. This is an open book test for you because most of people are not using the correct approach. Okay. And I want you guys to use the correct approach, please. That's why you can have the book open in front of you. That will not affect your performance in my eyes. Okay. So in the station, the letter will say that the patient has got this test positive. There will be no other report attached. Okay, so please don't ask me for the report. And you will just need to So Manikam, you are back after lots of sessions, isn't it? I think after 2 sessions, maybe. Thanks for coming. I like to see you guys.
Yes, ma'am.
How are you? Hi, how are you, Manika?
Fine, ma'am. I'm fine.
Good.
Thank you, ma'am.
Good. So let's see, sharing options, share screen. Okay, so, so are you ready, Falak? Let me make sure that you are able to see everything. Okay. Okay, started your timer. Okay, anyone who is not happy with this being uploaded with their image should probably switch off the camera. Otherwise, this would be shared. Would it be okay with you, Falak? Yeah?
Yeah.
You're looking beautiful, so
You are looking very lovely, actually.
No, come on. I didn't say it for a reciprocal tarif. But thank you. So I think I should add this chat on direct on Telegram as well. So if it goes there as well, if somebody wants to hear from there without joining or anything. Okay, so we're starting a station on syphilis in few seconds. What's that? Oh, Adela, I read your message now that you wanted to participate as well. Sorry, yeah. So sorry. Okay. So,
Hello. Hello, I'm Dr. Falak. I'm one of the senior doctors in the antenatal clinic today. May I confirm your name and age, please?
hi, my name is Anna Harvey, and I'm 26.
How do you prefer to be called?
Anna is fine, doctor.
Anna, I understand from your GP's letter that you were 12 weeks into your first pregnancy and you have some concerns to discuss today. Am I getting it right?
Yeah, doctor, my GP said that there is some problem. He said he did some tests and so he said he did some routine tests and something is positive, and I'm worried what's going on.
No problem. No problem, Anna. We are here to help you and support you at every step. I'll be shortly addressing all your concerns, but is it okay if I ask you a few questions first, just in order to have an idea about your general well-being, and then we can together make a safe and mutually agreed plan for you? How does that sound to you?
Okay, doctor, sure, that's fine.
So, Anna, can you tell me more about your pregnancy?
Yeah, doctor, I was not really planning, but my partner and me were happy really that I'm pregnant. It was a surprise, but we liked it. And,
so you're happy
fine.
to continue?
Absolutely, yeah. And it's going fine as well. I didn't even have any sickness, so we were really happy. And I've got
That's
this
great.
new partner. He's also very happy. He's very supportive and very happy. So
that's great, Anna. That's really great. Anna, do you have any complaints at the moment, like feeling sick or any pain in your tummy?
not at all, doctor.
And were you taking folic acid?
I was not, but when I went, it was my pregnancy was like but a test was positive about 5-6 weeks ago, and my GP did prescribe me folic acid. I'm taking that.
Okay, that's great. Anna, your GP mentioned that you have an ulcer, like something on your vulva. So can you tell me more about it?
There's no ulcer, doctor.
Is there any swelling that you are feeling?
It was just a tiny bit, like like something just like what can I say? Like we get on something acne like thing. I don't think anything in that. Yeah.
Okay. Is it painful, Anna?
No, it's been there for a very long time, doctor. It's I think it's just that
Mhm.
Sometimes the hair they grow in and something like that. It's been there for 5-6 years really. I told the GP, but he was worried.
Okay, okay. Okay, Anna. Any other concerns on that swelling that you are having? Any concerns on that pain or any discharge from that?
Not at all, doctor.
Mm-hmm. Have you recently had a fever or flu-like illness?
No,
Mm-hmm. Have you noticed any rashes on your body
not
recently?
no, doctor.
Any ulcers in your mouth or any swellings, any other part of your body?
No, doctor. I never went to my GP other than when I found out my pregnancy test was positive. Really, I know don't have any.
Okay, okay, okay. And is this your first pregnancy, Anna?
This is yes, yeah.
Okay. Anna, are you in a stable relationship?
Uh, I am. My new partner. He's with me for the last 4 months now, and
Mhm.
uh, actually 5-6 months, I think. Yeah, almost 6 months.
Mhm.
And yeah, he seems to be my type person. We are, we're good with each other.
Mhm.
So
That's great. Have you or your partner ever been screened or treated for any sexually shared infections in the past?
I never had any issues. So no, and I don't know about him.
Mhm.
Never
Any
asked him.
allergies? Mhm. Any allergies you have, Anna?
No,
Any medical conditions for which you are taking regular medications for?
I did say, doctor. No,
Any surgeries in the past?
no.
Mhm. And how is the support at home and in life?
Yeah, my partner is very, very, very supportive. He's a lovely person. So, and my parents as well. They're so very supportive.
That's great. Thank you for sharing the information, Anna. I would like to examine you in front of a chaperone just to have a have a general look if and check your weight to height ratio and also to check your tummy if there is any pain. Will that be okay with you?
Okay, doctor.
Thank you so much. So, Anna, your GP did some blood test for you. Are you aware of the results?
No, doctor. As I said, he said that
Mm.
he has some concerns and
Mhm.
he referred me to you.
So, Anna, we did check you for an infection that we called syphilis. This is basically caused by a bug. So your test has came out to be positive, but this is a screening test. This is not a confirmatory test.
Oh,
In order to confirm it, we need to repeat this test.
oh, okay. I know syphilis. I mean, I've read about
Mhm.
it. That's very
Mhm.
strange. I've never had any, kind of.
Mhm.
Uh,
So, Anna, this is not the confirmatory test. We
oh,
need to get it checked again. And the good thing is that even if the confirmatory test comes out to be positive, there are treatments available for this infection.
okay, okay. So
But
it's not for sure, yeah, at the moment.
it's not for sure. I need to
Okay,
confirm it on another test. But
okay,
if the second test comes out to be positive, Anna, then it can have some implications for your baby. But treatments are available for that,
what
and
can
they are successful.
what can you do to the baby?
And this bug can transfer through your afterbirth to your baby. If not treated properly, it can cause infection in your baby as well. But we have an antibiotic that we call benzyl penicillin. It is very effective. There is just one dose that we give to you. As you don't have any allergies, you can receive benzyl penicillin. It is given in the muscle. You might experience some symptoms after receiving the injection, like having fever or maybe having some chills. That is something that we call Jerish Herxheimer reaction, but that is not something to worry about. Are you following me?
But doctor, what happens to the baby if baby gets infected?
If we don't treat it properly, in that condition your baby can get infected and it can affect baby's several organs. It can affect baby's bones,
Oh,
baby's teeth. There can be several consequences on the baby, but with successful treatment we can prevent this from getting transferred to the baby.
oh God, is it? That's scary. So what will
I'm
happen?
sorry. And I'm very sorry if I've scared you. I didn't mean to scare you. I just want to
Oh, no, you
want
didn't
you.
mean to. No,
Yeah.
no, absolutely, you didn't mean to, doctor. But
Mm.
it's very it's like something happening to my baby. I mean, it's my first baby. I can't really
Don't
imagine.
don't worry, Anna. We have an excellent team. I will be involving my consultant. We will be involving the gum physicians who are experts in dealing with such infections. We
Okay.
would be giving you antibiotic, and we will be checking your. We will be doing regular scans for your baby. One of them would be a detailed scan at 18 to 20 weeks to check if your baby has developed any complication, but usually with successful treatment babies don't get infected, but still we will be having a strict check on your baby throughout your pregnancy.
Okay.
Mhm.
What do I need to do now?
What we need to do for you now is I will arrange another test for you. I will be involving my consultant. I will also be involving the gum physicians. And Anna, I want your partner to be tested for, suppose this comes out to be positive. In that case, we also have to get your partner tested because there is a possibility that he might also be infected.
Oh, okay. Okay. So, okay, yeah, I'll talk to him.
Mhm.
Could I have got it from him?
It's not necessary, uh, Anna, but usually it is a sexually transmitted infection. I'm not sure if you have got it from him or I'm
Oh.
not sure. It's difficult question to answer, so I'm not sure about that. But we need to check him too.
What happens if my baby, shows some signs like abnormalities or something?
In that case, Anna, you have the choice. You can either choose to continue the pregnancy. Some women in your place might not want to continue the pregnancy. So it is entirely your choice. Whatever you wish, we are going to support you at all steps. But let me tell you that we are here to support you at all times. And I will be writing back to your GP, Anna. With your permission, I will book another appointment for you. I will get your blood test arranged. And the next time we see you, I'll make sure that the consultant is also available. And thank you so much for your time.
Okay, thank you, doctor. Thank you. Yeah. Okay. How did it go?
I don't know. You will be telling me because I have no idea.
Yeah.
Yeah.
Shall we get Usha to try, and then we'll come back to the feedback together. Yeah.
Okay, let me try. Yes,
Usha? Yes, please.
yes.
So let's uh, Adila, you have been saying for a long time. Adila, did you want to try as well?
I'm really sorry, Sam. I'm busy now, but I will
I'm
listen to.
sorry. I didn't
Thank you
realize.
so much.
Yeah.
Thank you.
Sorry. Okay. So let me share the screen. Do you need 2 minutes, Usha?
No, actually, okay, give me 2 minutes. Yeah, I can think about Yeah, read the screen. So
Yeah, okay. So okay. No, I'll give you 2 minutes.
Hello. Hello, I'm Usha, one of the doctor in antenatal clinic today. May I just confirm your name and age, please?
Hi, I'm Anna Harvey and I'm 26.
How may I address you?
Anna is fine, doctor.
You call me Usha. So Anna, I understand you are 12 weeks pregnant and this is your unplanned pregnancy.
That's right, doctor.
Yeah, but you are so happy to. So Anna, do you have an idea why we are seeing you?
Doctor, my GP ran some tests and he said there was something that he would like you to explain because he was a bit concerned.
Yeah, that's right. Okay. Anna, any other particular concern which you want to discuss today apart from that?
No, not at all, doctor. Everything is going fine and we are happy.
That's good to know. So Anna, how has been pregnancy so far?
Yeah, all okay. No worries at all.
Okay. And so this is your unplanned pregnancy. So were you using any sort of contraception?
We were using condoms, but got yeah.
Okay. Yeah, condom is good for preventing sexually shared infection, but as you know, this is not very reliable. So continue that. I mean, so after pregnancy over, we will talk reliable contraception.
Okay.
Okay. So Anna, are you using any sort of medication for any other reason or?
No, not at all.
Okay.
No, doctor.
And following your GP for any other reason?
GP just gave me folic acid when
Folic acid.
I
That's very good. Okay. Are you allergic to anything?
I'm not, no.
Okay. And are you aware of your height and weight ratio?
It's 21, doctor.
Okay, good. And any other reservation if require for blood transfusion?
Do I need blood transfusion, doctor?
No, it's not now. Maybe I just want to confirm. And are you aware of your blood group?
No, I'm not.
Okay, that's fine. Anna, some personal question. If you don't mind, can I ask you?
Okay, sure.
Yeah. Okay.
Can you tell me what was the reason that GP referred? What was the
problem? Yeah. Okay. Anna, I have got your GP has referred because you have got some swelling down below on your lip of labia.
Swelling, but I told him that was just like a pimple.
Yeah. Okay. Do you have any fever, any rashes, any headache, anything?
I don't, doctor, but he said he did a test and he said actually he was referring because of the test.
Because of this test, yeah. So, we do test for everyone. So that's why this is normal in pregnancy. We check all the bugs. I may ask you a few more questions before giving you.
Yeah, okay.
Do you smoke at all?
No.
Do you take alcohol?
No, doctor.
Any other kind of recreational drug?
No.
Okay. And any discharge from down below? Nothing?
No.
Okay. And have you ever been diagnosed or treated for you and your partner for sexually shared infection?
No, never.
Okay. And have you ever had sex with anyone else apart from this partner?
No. Doctor, this is my new partner in the we're
how long
for more than 5 months now, and previous partner we broke up quite some time ago. I'd never had sex with anyone else other than that.
Okay. So Anna, I can check your this report and have some concerning news.
Okay, what's that?
Yeah, because that your test result shows you have got infection. It is caused by bug. We call it Treponema pallidum, and this is a syphilis. Have you ever heard about it?
I have heard about syphilis. Why did I have syphilis? I mean,
Yeah, it
I
is.
know what it
uh,
is.
mhm. Yeah, actually, it is a sexually shared infection.
Yeah,
If
I
you
know,
know,
doctor, but why would I have it?
actually, sometime if this raw area touches, if anyone has got this infection, and they by touching or
But
kissing, sometime this can happen, but we don't know. And we have able
doctor, all I know is that if there is a high risk sexual attitude, then somebody gets it. But I don't have
yeah.
that. That's what I'm asking you. Why would I?
Yeah, because sometimes people don't have any symptom, and if somebody have sex with them, so by that touching that area, raw area, ulcer type of, and
Are you sure that I have it?
yeah, we will confirm it. It is a suspected. We will confirm it, and then if it is it comes again positive after confirmation test,
Okay.
then yeah, but don't worry. We have got treatment. It is a treatable condition. So,
Okay.
and we involve a specialist to yeah, we call it gum clinic, the infection, the people who treat infections.
Oof,
And the
okay.
reason, yeah, we will, because we will check other type of infection as well.
Okay.
Yeah, and other things, um we will your partner will be tested. He might have this condition, so we don't
Oh
know.
God. Okay. Oh,
Yeah,
it's
so
him then.
yeah, we don't know, he might have, so that's why he will be tested. And the coming to for your baby, because it can cause your baby, so we need to treat it, give you injection,
What can it cause
penicillin.
to my baby?
Yeah, actually it can pass to your baby, so that's why it is really important
It
to
can
have.
cause what to my baby, doctor?
What did you say?
It can cause what to my baby?
Yeah, it can cause miscarriage. It can cause a baby can grow smaller, and sometime baby can die inside.
Oof.
I'm not scaring you, but don't worry. It is early stage. We will give you injection penicillin, so it is a treatable. And yeah, so and
Okay.
when it is caused to baby, it can affect baby's brain, baby's nerve, and heart. So we will refer you to fetal medicine unit. They are specialists. They will do detailed scan at around 18 to 20 weeks to see
Oh,
baby's development.
oh God. Okay.
Don't worry, we are here to help you. Our team.
But
Yeah.
what if baby has these problems? What will I do?
Yeah, so that's why you can around mid pregnancy, a specialist will look in detail. If baby has got, you can choose either continuation or termination,
Oh
whatever.
God.
We will
Oh,
respect whatever your wishes. We will
oh
respect you.
God. Okay.
I know it's a came as a shocking. We
Mm,
if you want, we can put you in support group and counselor
yeah,
to came
okay.
over this situation.
Okay, yes, please. Yeah.
Yeah, and I'm giving you information, this leaflet. You can read more about this condition, and I will inform my consultant and involve a specialist to in your care, because
What are
as
you going to do from now? What do I?
now
What,
now we will arrange another test to confirm this,
okay.
and we will referring you to infectious clinic as well for other infection. do you
Okay.
do you have any other question for me?
Oh no, I don't understand what's
have
going
you
on.
have you had ultrasound yet? No.
I I don't have any ultrasound.
Yeah, so we will arrange a scan for dating scan, and
Okay.
then second scan as any other lady, and also blood test to confirm this. Anything else do you want to ask from me?
Okay. No, I just don't understand what will happen now. How will my pregnancy go? I don't understand what will
Yeah, so
happen.
that's you need to, as if this come positive high risk pregnancy, we will, as I said, your we will after we recommend you to have a baby in hospital. So after that, baby will be tested for syphilis. Baby doctor will be check baby by blood test, and you will have a normal delivery. There is no indication for cesarean, and we will look after. You need to have a more scan. We will follow your baby's growth continuously, and more scan. That means you need to come visit very more frequent as compared to other ladies.
Okay, okay, doctor. Oh God. Anything you want me to do at all?
Just to prevent yourself using a condom when you, and during treatment, should not have a sex once you treatment finish, and
Okay.
use a condom for safe sex.
Okay.
So, and I'm giving, if you want we can, and this is a confidential, we will not share with, if you want we will not share with your GP. Is up to you, and not with other person, but your partner will get a notification from infectious clinic.
Okay, doctor. Yeah, no, you can tell the GP because of course he's looking after me. So yeah, that's not a
Yeah.
problem.
Okay.
I'm just very worried now, quite worried.
No, you will not. We can reassure you it is a treatable condition. Thank you for your time.
Thank you, doctor. You see, I forgot to run the timer for your 10 minutes. Okay, girls, are you okay if I can encourage all of you to give comments on this, and I will come back in 5 minutes? Yeah,
definitely.
Comment, you and Falak both, you can make a list, okay, and try post here whatever you thought were the points. And everybody, please welcome Mahi. Who is Mahi? Welcome Mahi, who will talk in 5 minutes. Okay, so I'll come back, just quickly sorting something out. Please talk to each other as well, and
okay.
Tell each other what are the points, and then share in the chats.
I did not read syphilis long time, so I don't know.
It's okay. You don't have to read syphilis.
I just wanted to go just like in an exam. If
you've done lovely, you've done quite a good job here. Okay, I'll come.
Excuse me, Sam.
I'm
Falak,
coming
please.
back in 5 minutes. Please keep discussing. Let me mute my mic before I go because I've got to sort out something important.
Hello.
Hi, hello.
Hello, Usha and Palak. Yeah, it was nice. Actually, I was driving, so I was, now I'm okay. I stopped it. No, the thing is that Falak, I think Falak did most of the things. And
but I just realized later on the things I missed were I didn't check her for other STIs. I didn't advise on safe sex practice. I didn't tell her about congenital syphilis birth plan, for which I should have referred her to PEDS. And maybe I could have offered a counseling, but I'm not sure. That is not very important. And confidentiality, I don't know, because the GP already knows if I could have added that or not. I'm not sure about that. But these things I missed, I realize them now. So Nanda, would you like to add anything?
Yeah. Did both of you asked about whether it is a first pregnancy? Because we don't know whether she has.
It was
not
there.
written. No, it was not
written.
It was not written. Oh my God.
No.
But she answered, no? She answered that this is the first pregnancy.
Yeah, she answered.
Okay. No, I was not aware of that.
Yeah.
So that is one thing. And second is a pregnancy care plan. That's very important. Consultant-led care unit, a team of doctors.
That one I think I said. That one I think I said it is a high risk now, so we will put you.
Now she is. It's not confirmed. It's only the screening.
After confirming. After confirming. If
so
result came positive.
That is important. If it comes positive, penicillin. No need for termination, right?
No. It's not. It's up to her. How can we say no?
Sunanda, if the baby is affected, she said, what if my baby is affected? What will happen then? So in that case, if suppose the baby has ascites, hepatomegaly, on all the
Yeah.
symptoms that are suggestive that the baby has actually syphilis, in that case it is a choice. She has the choice to end the pregnancy. It is her decision. She
Yes.
actively asked. I think I shouldn't have mentioned that, but because she said, what if my baby is positive and what if my baby is affected, only then I mentioned that thing, not by myself.
So most of
I
the
don't.
babies with
Yeah.
syphilis, if they affect
Yes.
also, they will not have any scan findings, all the babies. So we have to
No,
make sure
no,
that we
no,
will.
no, no, Sunanda. If her baby is, heart is affected, brain is affected, so his baby will have a congenital syphilis.
That is suggestive, but
So
actually Sunanda is trying to say something else. Yes, Sunanda, you can say
yeah.
so that we
Okay,
can
go
think
on.
on it.
Sorry,
So if the patient with syphilis in the early weeks of pregnancy, if baby gets affected, so usually what we can say that we are going to refer her to the fetal medicine unit.
Yeah.
And then if it is confirmed that baby also has the features of has hepatosplenomegaly, all those things, I think it will not take so much early to get the baby's part also. Before that, if it is confirmed, we will start penicillin injection. This is a treatable condition. So we need
Sunanda,
to make
that's
sure
what
that.
I told her the same thing, that we have treatments available and usually baby does not get affected with proper treatment. But when she said, what if
No,
my
it will
baby's,
get affected.
yeah.
It cannot say that because in the talk it is written that in the early weeks of pregnancy, 100% baby can get it. But in the same talk, it says that 50% of the babies can have the disease at the end. See, affection is different. Getting the disease is different at the end of the pregnancy. We have to make sure this point.
Okay.
Infection is different. Baby getting these features are different. There are two entities.
Hello.
Okay.
Hello.
Yeah.
How are you? All of you.
Yeah.
Yeah. I did not have the chance to listen to you, Falak.
Yeah, Sunanda, please go on. I really
Yeah,
want to hear
but
feedback. I did
there
not
is
read
one thing
the
I
talk
would like to
actually.
say regarding the baby. You refer her to the fetal medicine unit. They follow up the baby. At any stage, he may develop this congenital or some sign. But also, you need to tell her if this result came positive, after the delivery, your baby will be seen by the pediatric doctor, the baby doctor, and they will follow up the baby till 2 years old. Because at any stage, he may develop some sign of syphilis. This is regarding the baby.
Yeah, that is true.
I agree.
Yeah.
Yeah, in chlamydia also same thing happens. In chlamydia, baby's infection, getting the baby infection is one positive infection. Getting the symptoms and the signs for the baby is different. So there are two numbers. We need to make sure that we have to understand these two.
Chlamydia in the fetus?
No, cytomegalovirus, sorry.
Cytomegalovirus.
Cytomegalovirus
Later on,
also, no. We can always give option of termination if the baby has the features. Because there is a small head. Baby also has microcephaly, right? So that is worse than the syphilis. So yeah, as somebody mentioned, like we have to test the baby after the birth.
Yes.
That is
Yeah,
most
that
important.
one I said. Baby will be tested, blood test. So we recommend baby, you will have a baby in the hospital.
And this patient only it is screening positive. So we need to confirm it.
Yeah. That one we both mentioned.
So if the patient is asking, will my baby get affected? Really, we are not sure. We need to get confirmed. So if that confirmation comes positive, then we have to refer her to fetal medicine unit. She may require frequent scans, like that we have to talk. Don't give termination for, I think we should ask Sam. They don't like termination of the baby.
No. Sam ask, if my baby is affected, what will I do?
And that's what I'm telling. Infection is different. Baby getting the symptoms are different. There are two entities in that.
Yeah, you are right.
But
Okay.
Sunanda, right now she was saying, what is if my baby is affected inside the tummy? Okay, you always have to tell her she has the right to choose. Yes, you are right. If infection at the time of delivery is something else, having congenital syphilis is something else. That's absolutely right. But she actively asked, what are my options if my baby gets affected? Of course, we will confirm it by detailed scan. If the baby has any features, then obviously that is highly likely that that the baby has developed congenital syphilis. If the baby has hepatomegaly, if the baby has ascites and all those things, that would suggest that the baby has developed infection. Obviously, that is obvious thing, na? So she asked that thing. We didn't tell her by ourselves that this is the option. She said, what if my baby is affected? Then obviously she has the option to terminate her pregnancy.
And one more thing, Sunanda, suppose a baby will not be picked up during pregnancy, but baby have got chances of congenital syphilis, and that symptom will appear later on. So if then she can say, doctor did not tell me this choice, and now my baby is presenting symptom, because baby will be born asymptomatic. But symptom will develop after congenital syphilis.
Let's ask Sam when she comes back. We can ask her about how to address that question.
How to address? Yes.
So, okay, Usha and Falak.
I did mention I realized the things that I missed. I didn't talk about safe sex practice, and I didn't talk about congenital syphilis birth plan. I didn't tell her that we might repeat. They will be checking your titer levels after 3 months. I didn't mention that. And confidentiality, I'm not sure, because the GP. So I think that were my flaws. Maybe I didn't mention feto-maternal unit, the word, but I did mention, I think, MDT. I don't know if it matters. Sam, I want you to give the feedback, actually.
Sure. I will give both of you feedback. First of all, please let me say that when I give feedback, I understand that all of you are preparing for this exam, and you know that checklist of feedback, all that minor things. I don't go and tell you each and everything for a reason, okay? I think if we make a list of like 25 points in the feedback, okay, then what happens is that the most important assertion of feedback, like most important points in the feedback, they get kind of bit
blurred,
lost in the crowd, if I may. When bigger things are absent, then I can highlight smaller things. If bigger things are present, I try only to highlight 3 or 4 important points so that you have a firm take-home message. What is it most important things? What are the most important things that you need to make a difference, okay, to improve yourself, okay? So when I don't give you those long lists, please don't think that I was not focusing on. So let's see what I noted from you. Falak, okay?
Yes.
So what I thought was that, yes, you were kind and considerate, and I loved the thing that you started with telling me the uncertainty of the result, because not everyone was remembering this when I was listening to somebody's audios and all that, okay? So this was something that you have to remember. This is not a diagnosed case, okay? This is only the first test that's positive, and it's likely that, you know, it probably the next confirmatory test will come back as negative, okay? So it's equally likely. So it was very good. I really liked it. I really started enjoying right from the start when you said that it's not yet confirmed, okay? Then, yeah, one thing that I've been trying to tell everyone is that you don't need a chaperone for non-intimate examinations, please, okay? For her blood pressure and for her even tummy examination does not require a chaperone, okay? That is on GMC website, and you can go and check. It's not what I'm saying, okay? It's when I insist on something, I usually make it my responsibility to insist only if it's a UK practice, okay? So the chaperones are required for the intimate examinations. Now, coming to this online examination, you will be having online examination. You're not going to say I'll examine you with consent and chaperone anyway, because you're not going to, okay? So
what if, Dr. Sam, what if they have some information behind, they want me to ask for the information and then provide it to me?
They will not
be a possibility?
There will be no information on online examination that they will hide. Whatever will be there.
Can I safely exclude this thing from my stations? for the-
Absolutely, absolutely. Okay, the RCOG has explicitly informed us that
Mhm.
no, whatever is given to you in the start of the station. There is no
Okay.
additional information in the online exam. Okay, you're not
Okay.
going to. So whatever additional information is verbal, like structured discussion, you're asking the examiner that, or in the labor
Mhm.
ward, you are asking. That's a different thing. But
Okay.
they're not hiding reports. Okay, they're not.
That was the
hiding-
only reason I thought maybe there is something in the examination.
Yeah.
I'm not sure, so that's
In
why.
our exam, we asked our COG, the consultants there who were running the course for our COG, and they said that no, we won't be hiding anything behind in terms of any documents, any reports, or any letters. We won't be hiding. But of course, when it comes to labor ward and structured discussion, you will be, it will definitely, they will have more information. You will ask, well, I would want to know the examination findings and I want to know this, and they will have information on those ones that they will verbally give to you. But no, they're not hiding anything. In the role play stations, definitely nothing hiding. Okay.
Okay.
So you can relax on that. Okay. So you don't need
Okay.
to say that. Yes, if you feel that there is a situation where you would really, in ideal circumstances, you would want to examine a patient, you can say that I'll try to give you a next face-to-face appointment so we can examine you. That happens if you feel that one of your patients, she requires his examination. Usually the lichen sclerosis comes to my mind, or something where you want to really see. Otherwise, GP would have examined, or they would have given to you that your colleague has examined and these are the findings. Okay.
Okay.
Okay. So wherever you think that this examination is required, then you will say, we can arrange another appointment for you at some point so we can examine you. Okay.
Okay.
And remember, when they have given ultrasound findings in, like, say, ectopic pregnancy, don't try to say that I'll examine you, because they have told you that this is, sitting in the tube and all that.
Actually,
There's
I'm
no
not
additional
sure.
advantage.
I'm just afraid if they want me to say that, or I don't know if they want the candidate to offer an examination. So that is my
They
query.
say that online examination, they don't want you to say, unless there is something that you think is very important, that I will need to examine her face to face. Then you will need to say that we can give you next appointment face to face so we can examine you. Okay. Okay.
That's clear now. Yeah.
Yeah. So that's safely excluded, because I'm not saying something that I'm guessing this. I'm saying that they told us this. Okay. So this is from the RCOG course. They told us that no, there is nothing like that. Okay. So otherwise, if I was doubtful, I'll say that this is my opinion or this is my view. But this is not my view. This is my information. Okay.
Right.
Okay. So now you talked about the test. That was good. You talked about the infection to the baby, and first you said infection, and then you talked about the anomalies as well later on. And then so what I felt was that here, when you see a patient and you have first 2 minutes, I felt that normal routine antenatal care was totally missing from the station. You absolutely were totally, it's called fixation error, when your mind is fixed on one problem. Okay. So she is here because there was this test, but you never said that let's book you with the, with our antenatal care services, and you will have consultant-led antenatal care and MDT and no, all that. Did you say that?
I didn't mention consultant-led care. No, I didn't.
Whenever a patient comes who has pregnancy and an additional issue, okay, then you will need to bifurcate your management. I'll do this. So I say, when you are in your first 2.5 minutes of the station, that's your processing time. Your processor here should start working in bubbles, or whatever. You like boxes, you make boxes. I like bubbles, I make bubbles. So I say, make, those bubbles in your head to say, okay, this is a patient who has come, there's a query of syphilis, so I need to address syphilis. Syphilis address then again goes into 2-3 different kind of subsegments. What are the subsegments of syphilis? That one, ascertaining the diagnosis, which you were doing very well. Two, how does it impact the baby, which of course you were dealing with that as well. Okay. And then three, how do we take care of the mother, how we take care of the baby. Okay, so you forgot about
Mother.
You forgot about mother, and you forgot about the neonatologist will do this and all that package for the baby as well. Did you mention that?
No.
Yeah, so there was lots of things missing, you think then? Yeah, it's just because of the lack of planning, I think. Otherwise you could quickly talk about few things. I'll tell you how I manage that. If there are so many aspects, I'll tell you how I do that. If I forget, remind me, I'll tell you. But the other aspect that you, other than syphilis, you remember she's pregnant. This is her first pregnancy. You found out from her. So she doesn't really have any idea of how would it go from here. Okay, so you will talk about a little bit about, like I keep encouraging my students to sum it up in like 50 seconds, that how will you do a normal antenatal care for her. So you have to quickly say it. Yeah, so we'll book you under consultant-led care. We offer consultant-led care. You will be looked after by a multidisciplinary team of doctors, midwives, and baby doctors. Just quickly say this. You don't have to remember all the list. Just if you said 2 or 3 words, that's fine. Don't be fussy because you're losing time. And you say that you will have blood tests and scans, okay? And you may need extra scans. Your scans will be, now you have said the sentence, your scans will be a down screening scan and a 20-week scan, which is done for abnormalities. So now all of this, because I am talking like I'm talking to kids, I'm talking in that kind of slow pace and trying to make you understand, but you guys will quickly say it in 50 seconds, not like you will still not sound like a bullet train. You'll be able to still say it. I practiced it, and I'm the slowest person when it comes to communicating the sentences with a good speed. I'm like, I take it easy. I prefer to chill and to be called that I chill. So even I was able to fit all of this in about 50 seconds, okay, or 55 seconds, all of this. So you'll be able to say that when you practice this, write these sentences, that how will you communicate, and you'll quickly say that to all the pregnant women who have other problems, and you want to make sure that you are addressing this as well. Do you get that, Palak?
Yes, doctor.
Yeah,
I'm getting it.
make quick sentence that covers everything.
Okay.
You will have, so we'll book you under consultant-led care. You'll be seen by multidisciplinary team of doctors and nurse and midwives and the baby doctors. Okay, we'll do your blood test now and then repeat them during your pregnancy. We'll offer you a scan for the to test for down screening, and we'll do another scan at 20 weeks. You may require further scans as decided by the MDT. Okay, so
I entirely missed her antenatal care.
You did. What I'm trying to say here is that you did, but that happens because we are thinking that this station is a jam-packed station. But you see that in 50-ish seconds, I've told you everything. Did I fuss about 11-week, 12-week down screening? I just said you will have a scan. And I didn't even say to her that I said you will have blood test now and then again in the pregnancy. So I didn't fuss my mind about, people who fuss, they are losers. You remember that, okay? I quickly said you will have blood test now and then again during the pregnancy. That's it. If she asks, you can always tell, but you are running short of time. You have to really quickly, and without sounding like a bullet train, I've mentioned that you will have blood test now and we'll repeat them once in the pregnancy, okay? And suppose there is a medical condition where you require more bloods, you can say that we'll have blood tests now and we'll repeat them in the pregnancy, and maybe quite a few times depending on how things go. You've said it, you've not been precise, you've not fussed your head, you've not, you're not banging your head in the wall that what are the weeks, what are the numbers, what are the figures that I'm giving. You have still communicated, and please do it like that. Otherwise it's a waste of time for you and for, for the station as well, okay? So don't fuss and just quickly go through this. If they want to ask something, they will ask you. Okay.
Mhm.
So this is you quickly address her antenatal care, and then you will. Did you mention about Jerish Simar, isn't it? You were talking about that.
Yeah.
So you were wasting time, yeah. So why
Okay.
I'm saying wasting time, I don't want to say that, but what I'm saying is that sometimes you have to, you have to prioritize. Are you going to focus on a small thing and miss the big scene? Because you were missing the big scene, you didn't have time, you ended up missing the big scene.
Sometimes they mention that this is a safety point and Jerish Eczema reaction is a safety point. I'm not sure. Yes, obviously I was short of time. Otherwise, I could have added many more things. The problem was I was obviously short of time, so I couldn't talk much.
No, you can obviously think in direction of that, but always remember that you cannot miss everything for one thing, isn't it? Like if you are getting distracted by something, that Jerish Haxima reaction and safety issues with that will not come at this stage, because she is not a confirmed diagnosis and you're not giving her treatment at this stage. Okay. You see, she is not a confirmed diagnosis. How is it safety point? Safety point is when somebody would be prescribing to her and not giving her information. Okay. So if this was the case that she came with first treatment and diagnosis is confirmed and now you're treating, then yes, it's a safety point. At the moment, it's just a luxurious information. You are just, you have much more important things to address here. Okay.
Yeah. I got your point.
Yeah. And Usha's question was very good. I really loved it that she asked about what contraception were you using, because that was an important point, because how I ended up with an unplanned pregnancy is a patient safety issue. Okay. Because I was healthy and fine and all that, but somebody could be suffering from some severe problems. And so it was a good thing to address contraception, which you forgot as well, Palak.
Yeah.
So what else was now coming to, let's come to Usha then. So again, Usha, I'm not giving a point-to-point feedback, but yes, Usha asked me about my BMI, which I think was a good idea because Falak, you said that you will check it. Even that was a good idea. That's not no harm. I'm just trying to say that both the things are fine. Okay. Knowing BMI, asking me and knowing is probably gives you a peace of mind that you already know that I'm fine with in that aspect, because of course somewhere in your mind you'll be thinking about VTE risk assessment as well, because she's pregnant. Okay. There were a few again questions which I wouldn't really this is a very big station. Okay, it's a huge station if you addressed everything that we want to, and I'll show you what some bubbles that I made on this. I'll show you just now, and you'll see that there's so many aspects to be addressed here, Usha. So I think the question about reservation to blood transfusion, what do you think about that, and blood group and all that? What do you think?
I thought if blood group negative, then we have to give her antibody during pregnancy, and blood reservation in case she choose if it came positive, and in case she choose that's like.
So you are going too much in case, isn't it? Let me tell you.
I know, but sometimes because people say no. You have to ask because of if Jehovah Witness that's
not correct. If people are saying that, they are wasting your time. Okay.
That's we are just confusing. Somebody said this, somebody.
I am sorry about that. I can only tell you because I'm here. I'm right here. I'm in UK for the last 19 years. Okay. What I tell you will be from UK. Okay. So it will.
Okay. Thank you.
Whatever you want to, then make your mind come at ease because of that would be good. So let me tell you, we are worried about say, reservation to blood transfusion when we are into, I'll advise in 2 or 3 things. Okay. One is imminent need of blood or almost impending need of blood. Okay. So I said if somebody is ectopic pregnancy or somebody is somebody is coming for a termination of pregnancy, or somebody is coming as a miscarriage and you want to take her
Then
back
in
with-
that station, okay.
Yeah, imminent theater means you will ask her reservation of blood
Okay.
transfusion. Imminent theater, absolutely. Or diagnosed as placenta previa, low lying.
Yeah.
You will ask her, definitely ask her. Or if it's just a simple booking appointment, there is not a huge
No.
station, there is not much to cover, then yes, be my guest and ask, okay?
Okay.
Because if it's not a too complicated stuff, busy station, yeah, no harm. You can make note of things like that, and you can document that. But when a station is so busy and there is no imminent requirement, then please save yourself the trouble.
Yeah.
Okay. Now you said NTD and blood group, but we don't ask patient their blood group for giving them NTD. Okay. We check their blood test. If the results come, if the station says that she's been tested and she's rhesus negative, then it's a different issue. We don't ask patient, okay, what's your blood group? They don't know. And you remember, Usha, you said last time that patients don't know I remember.
Yeah, don't know. Then I thought, okay, this might be, I know that nobody knows their blood group.
Yes.
So that's, but then again, I thought maybe this was a safety point. So I just myself.
Don't feel pressured and don't feel, too lost. I'll say that NTD, yes, definitely we want to make sure that if it's, so when will I worry more about NTD in this patient? I will worry if this was, say, she came with some episode of bleeding or spotting, or if we know again that she's a placenta previa, may bleeds at some point, I may then, I may say, are you aware of your blood group? I may say, or I'll probably check her notes to see what's the blood group there. If it's not mentioned in the letter or in the notes, I'll probably say, okay, are you aware of your blood group at all? We may need to give you an injection if you are negative, just in case when you're bleeding, okay? So we may give her a hint that we want to know her blood group, and that's a different scenario if that's when there's a risk of bleeding or intervention. We want to intervene, we want to put instrumentation, then we will talk about, otherwise don't waste your time, please. You don't have time. It's a very big station.
I know.
Yeah. So then you did another thing as well. You did you said that your GP has referred you for a swelling. The GP didn't actually refer for the swelling. Swelling was only mentioned there. GP referred me for the test. Okay. So, and I am keen to know about the test. So you keep, kind of avoiding my question and avoiding answering my question for quite a few minutes. So I'll say, if the patient is saying, if the patient asks you that, doctor, I'm worried, what was the result? Then try not to delay the explanation of the result. Okay. So you say, yeah, this is my concern. This is the GP's concern. This is your result. And we can talk about this and all that. So try to explain it before
immediately. Okay.
Yeah, it's a good idea. But even if you said that, okay, can I ask you a few questions before I can explain, then keep them to few questions, not detailed history. And if she intervenes and she says, doctor, tell me about the result, then at least then don't delay. Okay.
Okay.
Then say that, yes, sure, I can talk about that first, no problem. And then you said, yeah, I said I know about syphilis, but you kept talking about triple and draw area and all that. That was a waste of time. Yeah,
I realized this later on. Yeah, I should not.
I was trying to save your time because I knew it was a big station. So I was trying to save your time by saying that I know about the station. And I'm not my sexual practices are not high risk. Why do I have it? So, the answer that I wanted to hear from you at that point was that don't worry, you may not have it actually. This test may come back as negative. We are not yet certain that you have it.
Okay. So I said, I said we will confirm it, but not in that.
You said that later on.
Yeah.
But I kept, I kept like mourning that why do I have it, doctor? Why do I I have it? Why do I? That was when I wanted to hear that you don't have it. We're not yet sure. Okay. So, I don't want you to worry right now. We can test you. Don't relax. Please don't worry too much. Let's test. Let's find out what the result says, and don't worry. And and then you can. So sometimes we are saying that no, you're not yet positive, and we still have to tell them that, because there's so much information to give. So how do we give that information? Either she will ask what happens, or we will say, although it's not yet confirmed, do you want me to talk about the implications? So she will say yes. Okay. Don't say you're not positive, but this is what it does to your baby. This is what it does to you. She will say, I'm not positive. What's your problem? Why are you going on and on? So because you have to give this information in the station, you can say that because this is, I can assure you, Anna, that this is not yet positive. Okay, please don't start worrying right now. I understand the stress. I understand your anxiety. Just don't worry right now. Let's do tests and let's find out. Do you want to know what's the implication? Do you want me to talk about what are the implications? She says, yeah, please tell me. And then you can talk about that. Otherwise, I've also seen people who, what they do, they say that it's not confirmed, but then they start bombarding, this will happen, your baby will have abnormalities, you will have this, you will have this. So you always say that it's not yet confirmed, but do you want me to tell you what are the implications if it was positive? You see what I'm saying?
Yeah.
Let her drive with you towards your marks, and keep the flow natural.
Yeah.
If it's not positive, why are you talking about it?
Yeah, I understand now. Yeah.
If it's not confirmed, why are you talking? So give an excuse, give an excuse, say that, do you want me to talk about the implications? Okay. And then she says, yeah, well, I'm with you. Yeah. Tell me, please. Okay. So I didn't want to hear treponema pallidum and raw area. What I wanted to hear was that when I said the first thing was that, yes, you may not be positive. Yes, it is a sexually transmitted infection. I'm saying that my practices are very safe. Why do I have it? So you can say, first, we don't know whether you have it, but if it comes back as positive, Anna, you said you're, you have a new partner. So it's always, safe to have both of you tested just to see, what's going on. And so all that. Okay. So that can be, so rather than, role player is not really interested in treponema pallidum, honestly. I mean, unless she asks you, tell me what is that bloody organism who does it. I want to go and shoot it. So you just say that I'll give you written information. Okay, she'll read. Otherwise, honestly, treponema pallidum, I can't imagine telling a patient that is treponema pallidum. Okay. So unless they ask, if they are very keen and they are asking, that's fine. Okay. So otherwise, the raw area and this, and you don't have to tell raw area and, touching and all that. And because I'm saying I'm not at high risk and you're saying touching, and I'm thinking, bloody hell, I'm not in any wrong practices with anybody. And you're saying touching, raw area of somebody who has treponema pallidum. So now you know why I asked. So you would probably keep that in mind. Okay. Also, when I said, are you sure? Then you said, we will confirm. So then did you realize that you said we will confirm? So what was the previous lecture about then? You
have rubbish.
Okay. So I said, what happens to the babies? You told me about that. That was good. Counselor support was very good. Falak had forgotten counselor support. Counselor and mental health support, remember, it comes almost in 100% of whatever stations there are. Mental health support comes in almost everything, really. Hardly anything where mental health support doesn't come in. Okay. Think of any disease, PMS, cancer, think of bladder pain syndrome, think of any problem, stress incontinence. Do you not offer everyone mental health support? We do, yeah? Epilepsy in pregnancy, Marfan's, Eisenmenger, any long-term problem going on. Twin pregnancy we can offer. We don't offer universally in twin pregnancy, but what we do is that in patients where we think that they are having mental health, and they are stressed or all that, we can offer in twin pregnancy as well. So you remember, this was a very good one. Leaflets and what's infectious clinic, Usha?
Gum clinic. I thought because if you came positive.
It's not infectious clinic, okay? Infectious means something that can give you infection.
So gum clinic in layman, what we say?
Gum clinic.
Just gum clinic.
Yeah,
okay, I thought gum clinic is jargon.
Sexual and reproductive health clinic. Infectious clinic is nothing. There is no term as infectious clinic, neither in the lay term and nor in the medical.
So, okay, so we can say to lay role player gum clinic.
Yeah, the no gum clinic.
Okay.
I will refer you to gum clinic. This is absolutely fine term. It's quite a common word, gum clinic.
Okay, I thought this is a jargon, so maybe I can.
It's not. Yeah. If you ever have any concern about it being jargon, you can always combine that with, I'll refer you to gum clinic, which is like sexual health clinic.
Sexual health, okay.
So sexual health, you can say. You don't have to say it all sexual and reproductive health clinic. That is too much.
Yeah.
Yeah, that kind of patient goes like, but you can just say sexual health clinic. I'll send you to sexual health clinic if you are. That's probably a more, a clearer rather than an abbreviation and all that. So it's clearer as well. You can use that. Okay. All right. So what is it that I wanted you guys to think in this one? Let me show you something. So Falak,
Sam, can I ask a question first?
Who is it?
This is Falak here.
Hi Falak, yeah, sorry.
Sam, actually, when you asked me, what if my baby is affected? I told you, you can continue, or in some women in your place might want to end the pregnancy. So whatever you decide, was that the right response?
Perfect. Yeah, that was perfect.
Okay, that's fine. Thank you. That was just that I was.
You were spot on. You were spot on. That if it comes back as positive. So if I was to add anything, I'd say again that I wouldn't want you to worry right now because we are not yet sure. But yes, if you're asking, because I asked if my babies, and you just said if. You were absolutely right. Okay. That I said if my baby is affected, and you said if some baby is affected, then some women may not want to continue the pregnancy and you have a choice. That was absolutely fine. You can always top it up with, let's keep our fingers crossed. Maybe it's fine. Maybe the test is negative.
Okay.
So keeping our fingers crossed is another option that we can. Okay, sorry, let me bring it up first. Where are these?
Sam, when you went for 5 minutes break, we had this discussion, like if the baby is positive, because that's quite rare, we need to know how, when she got this disease. This patient is not even confirmed. So if the baby gets affected, that congenital syphilis, in the first trimester, transmission and getting the congenital anomalies are two entities. That's what I was explaining to them. In the first trimester, it is 100% primary syphilis, it is getting affected. Then transmission rate, but getting the disease after the birth, it is 50%. So it's quite rare. This baby has to be monitored by the fetal medicine unit. That's what I was explaining to them, that we will not offer all the patients termination at the first visit.
You are right, but because we are never, I get your point, and that's a very, very valid point. And that how will we know that we will say that we will arrange if the test comes back as positive, we will arrange a meeting with the fetal medicine unit. They will be able to do the scans and advise you on the prospects. If the prospect seems to be so, severe, then we will support you in whatever decision you make. So you are right and absolutely right in saying that it could be, whether this disease will be there or will not be there will depend on these kind of situations and conditions. But you remember that we are never like 100%, and we don't want her to be saying that I want to terminate in this pregnancy, and we are saying no, the baby is not affected, and in the end the baby is affected.
No,
So
we have to tell that
yeah,
point we have to tell, and
but
we
you are
should give
right.
that insulin.
Yeah.
That penicillin, it's a treatable condition. We need to
Yes.
say that one line that patient will understand, right?
Absolutely, it's treatable, but if the anomalies have happened, like if if it has already affected, it's treatable. I mean, you can treat the infection, you can't correct the congenital abnormalities that has happened already. Okay, so
The
you
treatment
can.
medicine will say no. Why we should into that
No,
this station.
we will say that yes, the baby. So that's what I'm trying to say to you here. That's what I'm trying to give you a safe sentence here. That you will say yes, if the baby is affected, we will support you in whatever choice you make. Okay, so you have not said anything, you have not claimed anything, you have not counter claimed anything, you have just said if it happens we will be here to support you. You have to promise her that that's support. You can't really say no, I'm not able to say a word, I'm mute, I'm zipped because I'll leave it to fetal medicine. No, you will say that if the baby is severely affected, we are here to support you in whatever decision you make. So you're not asking her to make a decision. How will she make a decision? We will certainly, as soon as your test comes back as positive, we will arrange an urgent meeting with the fetal medicine unit so that they are able to advise you of the current situation, and they are able to assess the baby's condition, and then they are able to advise you how severe it is and where should we go from here. Okay.
Thank you.
You will still have to say that we'll support you. You can't just say hands off, I'm not in this at all. You can't do that. That's not, she's your patient, and you will have to express your support, and that's absolutely fair because you are not guiding her without any medical evidence. Okay, you're just telling her that if it happens, we are with you.
Okay.
Yeah. So if I can share this, so have a look at these things that I think are you able to see the bubbles? Is the screen showing up now? Yeah, are you able to see now?
Yes.
Okay, so what are the antenatal clinic 12 weeks? She has syphilis. What are you doing? You are first of all focusing on whether the diagnosis is certain or not, and we have this little summary here that these are the tests for the primary screening. So I know in the role play station you don't have to tell what tests, okay? But suppose why I'm writing here the screening test, because if the GP actually sends you the tests, how would you know that these are primary screening or these are the confirmatory tests? So you should know which ones are which ones, okay? Got it, girls? Wake up, girls. Is it time to sleep?
No, yes, Dr. Sam.
Okay, so why I made this point is that if you are seeing a GP referral letter, you should be able to get it from the letter whether you are looking at a confirmatory test or at a screening test. They may not always say to you that it's a screening test, okay? They may just say that these are the positive tests, okay? Got it, girls? So EIA and CLIA are the primary screening tests, and then the positive, when they are positive, then you go for the confirmatory testing, and confirmatory testing is with RPR or VDRL, okay? And there are two samples involved. First, you do confirmatory test on the first sample, and then you repeat the tests on a second sample as well, okay? And there is some mention of 3 monthly repeating in pregnancy. I think that's for the high risk cases. Now, what are you dealing in the mother? You will deal with the infection element, and then you will deal with here the fourth box says you will deal with the antenatal planning element. Fourth box means this one. Can you see the mouse? Are you able to see the mouse?
Yes.
Okay, so here
Yes,
is
ma'am.
you're dealing with the maternal infection element and dealing with the antenatal element, and then infection element also involves dealing with the social and sexual aspect. Okay, like what are the points that come in here, what are the points that come in here, think of all the points, and then dealing with the baby, dealing with the fetal and neonatal infection. Okay, whatever the risks are involved, infection can be as early as 8 to 9 weeks of gestation. Severe effects can cause miscarriage or stillbirth. She will require FMU referral. Congenital abnormalities, never forget that. Okay, what are the treatments that will be required? And remember, in this one, if the patient is penicillin allergic, then this is one of the conditions where they say allergy testing and treatment of the desensitization is because penicillin is so extremely effective against syphilis that they consider desensitizing as well. Okay, so this is not just okay, don't give that situation here. You can, but it will be even better if she can be desensitized and given penicillin. Okay, what else do you think you need to know? Whether this is primary syphilis, secondary syphilis. So your questions will have to be based on that. Okay. Yeah. So full syphilis history that's given in the BASH guidelines, remember them and ask at least few questions from there so that you look like that you're asking a full syphilis history. If she's already diagnosed, or is she just coming with just a screening test, you need to note that. Does she have any lesions at all? Is it secondary? Is there any history of jaundice or eye problems or facial palsy or headaches or neck stiffness? You're trying to rule out all those meningitis and all that, neurosyphilis and all that. Okay, and then first line you remember is penicillin, second line is ceftriaxone, and they do not recommend erythromycin or azithromycin now, and desensitization is a very important option here. Okay, and then sexual history, you will have, again I'm saying, you will remember the full sexual history, sexual behavior, recent change of partner, multiple partners, visit abroad, coming back from holidays and bringing back from China. So whenever there is a syphilis question, the poor woman had gone to China, something like that, or Bangkok, Thailand. So this is, what they portray in the stations. So, and yeah, of course, one more thing that's important is if these high risk factors, please try to remember, I said, I presented as a person who doesn't have any risky sexual behavior, but remember the people who are homeless, who are on drugs, or who are refugees, or people who have safeguarding issues, okay, domestic violence and all that. Okay, please remember those aspects as well. They can be included. You will offer a full battery of the gum to them, so you will say that there will be further infections will need to be ruled out. You didn't say that. None of you said that. So do you think this is a big miss? Usha and Falak?
I think Dr. Sam, Usha did mention.
Yeah.
I did mention.
Usha mentioned? Okay. Usha, did
Yeah.
you mention
Yeah.
mention the gonorrhea and the chlamydia?
Yeah, I said other sexually shared infection,
okay.
David. That's why we are referring you gum clinic.
Yeah. Okay, I remember now. Absolutely. Yeah. Yes, yeah. Okay. So yeah, so always remember that these patients could be, why would they be having this? Like I presented like a very decent, and I said I'm not at a high risk of sexually transmitted infections, but if I wasn't saying that, or you will think of, if I'm, you asked me if I was supported, that was a good question, and it's very relevant, because otherwise I could be at risk. Okay, I could be a homeless person who, they can have anything, poor people, they don't have anywhere to stay, and then sexual history goes like all over the place. Okay, or a refugee or whatever. Okay, so if it comes to that, then you will describe antenatal care, of course, obstetric team, MDT, joint clinics, extra visits. Of course, we'll talk about blood pressure and proteins and all that. You don't need to go into nitty gritty. You can just talk about scans and bloods when we are running out of time. Okay. VTE risk assessment is a good one. That is something of a safety issue. So you will try to mention VTE risk assessment in somehow trying to do the assessment as well. Okay, then yeah, just say labor and delivery. You can just say that this is not an indication for cesarean section. That should be just fine. That, but we'll, you know, a multidisciplinary team will look after, and a neonatologist will be involved, and they will take care of the baby from right from the point of birth. This is what you want to say. Actually, this is not an indication for section, and the baby doctors will be involved right from the start to look after the baby if the baby needs any, you know, whatever treatment the baby needs. Then I wanted you to see this page in the BASH guideline. This has got clinical history in detail. Okay, so this is in the BASH guideline. I extracted from there. Do you recognize the page? Does it seem like you've seen it?
Yeah.
You won't
Yeah,
have
we
seen
have
it with the colors, but yeah, colors are mine. Rest of the pages from BASH. Okay, so these history points, try to go through them. Okay. And what else I wanted you to see? Yeah, desensitization. Yeah, this chart from your, algorithm from your TOG is a good one as well. Okay.
Okay.
Any questions from, are you still scared of syphilis, Usha? You shouldn't be now. Yeah.
Not now.
No.
We'll read again this talk. I did not read.
I don't like, I say, even if you don't read full talk, that's fine. Just,
Yeah,
you know,
just this.
when I do readings, I do like, I'm very choosy. I never find time. I'm not that brilliant to go through all the talks and all that. So I pick up the tables and the algorithms. Okay. They are my favorite ones. And then because TOG has a limited kind of value for me, that's why I go to national guidelines. Okay. So I picked up that page from the BASH. Okay.
Yeah, treatment point of view, say I read before, because if she comes in first trimester or second trimester, or then treatment will be
absolutely. No, even treatment point of view, BASH. Okay, because BASH is national standard. What happens is that if I read TOG, I will also always want to make sure whether this is as per national guidance or not, because I don't trust the articles that much. Okay. So if I have to again look at the national guidelines, then I start with the national guidelines rather than going first there and then there and then.
BASH is very long guideline.
Yeah, you need to read like a bird eye reading. Okay, quick scan which ones are important parts. I've not read all of it. Okay,
it's very big actually.
I quickly scan and see whichever is the most important thing, which I put boxes around it, and that's it.
Okay, thank you.
So you are right, it's a very long guideline. I can't.
Yeah, very. I know, it just started, and then by just get bored. When you come real actual things, by the time you get bored.
Yes. So I always follow the headlines. Wherever the headlines are there, I just look at few lines underneath the headline. That's it. That's my reading of the BASH guideline. Okay.
Okay.
Just few lines underneath where it says management, recommendations. I just read few lines underneath. Sometimes I enjoy reading in detail when I find time. I do enjoy actually reading guidelines, but yeah, when I'm in a rush, I just read whatever is under the headline. But because your answers should be based on guidelines. Yeah. So any questions in respect to this syphilis? Because I thought syphilis was quite a tricky station, and I thought people would be baffled when they saw the station in the exam.
No, it was very good actually.
Yeah, if you cover, okay. I said to Falak that I'll tell you how to address if it's a huge station. Yeah, how would you address that? Do you guys think we should do like a quick some tip on how do you address the huge stations?
Yeah, we can try. That would be great.
So just a couple of points I want you to remember. Really, it will be when you try a station, you'll find out. But for those of us doing face-to-face, should we still skip the examination, please? Okay, I don't get the, sorry, I'll come back to this tip in a minute. Who is Zoom user? I don't get the name of the Zoom user. Is she still here? Zoom user. So who is Zoom user? Do we have a name?
Yeah, my name is Dr. Tony.
Your name is, sorry?
Tony, Tony.
T-O-N-I, Tony.
Yes, please.
Hi, Tony. So
Thank
welcome, Tony. So yeah, you said in face-to-face, it's different. Yeah, this was only for online examination that the RCOG said that, you know, all the details that I told you. So in face-to-face, it would be just like before. You can ask that, do we have examination findings on this patient if the exam, or you can mention to the role player, absolutely, that I would like to examine you in front of a chaperone, you know, with your consent and in presence of a chaperone, and then they will probably give you examination findings. RCOG hasn't mentioned anything because it wasn't face-to-face for us. They didn't mention anything. But are you appearing from London, Tony?
Yes, please.
Oh yeah, okay. So it might be, you know what, it takes only a few seconds to say, I'd like to examine you in presence of a, you know, chaperone. So if they have something, because they will probably. Now, I also want you to remember one interesting thing, Tony, that they will probably keep the stations just like, you know, they are doing it for everyone. So there will be less chance, less likelihood that there will be stations that will require examination, okay? But absolutely, absolutely safe side is that you say, I will examine you in presence of chaperone. Okay?
Thank you.
Yeah.
Thank you.
We want to be safest. We don't want any deduction of marks at all. We want to be safest. So if it's face-to-face examination, you can say, I'd like to examine you. Okay.
Thank you.
You're very welcome, Tony. So, okay. Anybody else? So Mahi, were you asking something? There's somebody who's asking something. I'm sorry if I missed something. You can ask anytime. Okay, just jump in.
Yes, thank you, Sam. Thank you. We learned so many things from you today. So only that the lesion, do you think it is medical jargon? What we can say instead of lesion?
You can say lesion. Why would it be a jargon? I don't think it's I'm not very good. I'm not brilliant with the jargons really. But lesion is not something that is a jargon. People keep using a lot of times.
Ulcer would be a right word, Dr. Sam?
She didn't have ulcer. So she didn't have ulcer. She didn't even have a lesion. Okay.
Yeah. So
she only had a tiny swelling really.
Swelling. So swelling we can say, isn't it?
Swelling we can say even if it was an ulcer, even if.
Because some session they discuss about the lesion. That's the, you know, the lesion is.
Lesion is not a jargon. Okay. So okay. Absolutely okay to say lesion.
Yeah.
You can also say a bump. B-U-M-P. Any bump? Because it's bump. You can use the word bump.
B-U-N-P.
B-U-M-P.
Bump. Okay.
Yes.
So, yeah. You can use the word small bump or lump or something for something. These are all, but again, this is not, are you trying to use the bump word for some lesion?
Yes. Can we? No.
Bump is swelling we can say.
Yeah, that would be just swelling, not like an ulcer. Yeah. It won't be like an open lesion, yeah? So
okay. For not some people can say sore.
So you could probably say that it's, you know what, I still feel that lesion is a better word.
Okay.
I'm open to input, but I'm still feeling it's not like giving the sore is like if it's red and if it's inflamed, that would be called as sore. Still doesn't say that it's like open ulcer. Even sore doesn't say. Ulcer is probably jargon. So lesion is probably better. And lesion is something people use a lot of time. So my patients use a lot of time. I don't know. So I won't think that it's a jargon. But Tony, if you come up with anything, you can please drop it in the group and say you found a better word for lesion. Okay? But please don't come up with some weird, you know, sometimes people come up with very weird kind of words. It's so funny words they come up with. What was a funny example that I wanted to give to you? Said bag of basket of eggs to ovary. What the, I don't want to say F here, but what the, so they said basket of eggs, and I'm like, so please don't go funny when you are, choosing your non-jargon. So let me quickly tell you what I think. How can you, before I forget, how I think you can handle the huge stations. So I think if you keep in your mind all your segments that I said, all your bubbles, that this is what I need to address. So keep saying 2 or 3 things regarding each first. The most important 2 things or 3 things. And if you find time, then you can go into any leftovers. Okay. So I think this is what I do. If a station is extensive, then I think in terms of prenatal, antenatal, intrapartum, postpartum, I have these 4 sections. What am I doing? Mother, baby. So I've got these kind of, and I have never tried to go into details. Like, I will never say Teponema Pellenum does this. So sorry, I love it. So what I'll do, I'll just go with the big things,
Yeah.
Like big. This is my way of dealing with the exam. That deal with everything, like you're playing with the snow and you're collecting it, throwing it quickly, rather no thinking, no nothing. I have little time. I have to sound nice and quiet and pausing and all that, but I have a lot to say to you. Okay, so what I do is I just go with the biggest things first. Okay, biggest things first. So 3. I work in my mind that I've addressed prenatal, antenatal, and intrapartum, postpartum, mother, baby, MDT. Okay. Whenever you're talking.
Sorry, I came out with something. Any raw area in the down below. Raw area.
Raw area is good. Yeah. You're good, Tony. You're fast.
Yeah, raw area. One session they mentioned raw area.
Yeah, raw area is good. Raw area is good. Okay.
Yeah.
That's a good one. Okay, good. Well done. So do you think you can quickly talk about 2, 3 things and just move on? Okay, because both of you girls, you took lots of time in the initial, kind of, should I say,
yeah,
initial concern sharing part. You discussed it, I won't say history taking, like I was interactive as well. So it wasn't only, I think still the first half of the station got too long. Okay. So you missed all the big segments then. So do you think, Falak, it would be a good idea if you kept saying 2 or 3 things and moving on?
Yes, I think so.
Not lingering with the emotion. Emotion is good. You have to come down to her emotion and respond to it, but don't linger with it. Don't get stuck to it. Okay.
Okay.
Excuse me, Sam. As you mentioned that that what is this? Asylum seeker and also refugee. So that kind of things. How I can ask the patient to know about this? He's an asylum
Who do
seeker.
you live with? Are you well supported?
To whom do you live? Yeah. Are you well
Not
supported?
to whom. Okay. It's who do you live with?
Who do you
People
yeah.
say to whom. I don't know why do they say to whom. That's not English. There must be some other language. It's not
It
to
is.
whom you live.
It is all session. Different
It's,
session.
it's not English. Whoever is doing it is not English. It's not UK English at least. Okay. To whom it's actually not English. Okay. So it's some Desi English. To whom. It's not to whom. Who do you live with? Okay. Who do you live with? Yeah.
Yeah. Thank you.
Any questions at all, girls?
And what you told that blood transfusion, that any reservation, really, we learn from you so many things to deduct from our bad things. So I present a few days just before one case. So I didn't mention about the blood reservation and transfusion, but they told why I didn't mention. Okay, so they
I'm sorry, sweetheart. I can't be responsible for those.
Yeah, that's right. So I didn't tell anything. Just I keep quiet because now we have to judge ourselves.
Yeah, absolutely.
Thank you.
As I said, what I tell you is what we do here in UK. Okay, so I can't vouch for people who have not worked here, who don't work here, and who have made their own rules and who kind of try to scare our dear students. Sorry about that. I can only say I'm sorry if it happened like that.
Super
Yeah,
things.
you
Yes.
have to make up your mind who to trust. Okay.
Yeah.
I tell you openly, I got
Yeah.
85% score, so there should be something to trust me.
No, of course. That's
A
why I'm
tiny
telling you.
bit.
Yeah. No,
Tiny
you
bit
can.
thing. But
Of
then I'm
course.
in UK as well. I mean, if some overseas person gets even higher score than me, you have to understand that what I tell you is not by chance correct. It's by
No. What
practice
we
as well.
learned today also, so many things, we learn new things from you. So I told that, of course, I appreciate, but this is not. That's why I told that we learned. That's why we are here with you. You know that we
Absolutely.
came
Okay.
here. We came here that to clear about that.
That's good. That's good.
Thank you very much.
Okay. And anyone else? Any other questions at all, please? Shall we call the day? Okay. So I guess no questions. I hope everything is clear. So
What case you discussed before this syphilis? I just joined very late.
no, you were lots of questions were going on.
Okay.
I'll try to upload. There were lots of questions.
Okay, thank you.
It takes me a few days to upload, but I'll try to upload. Okay. Yes. Oh, I didn't even see that there was somebody called Reena here. Thank you, Reena. Yeah, I'll try to share. Okay. Yeah, a few people I think joined later on, and I didn't manage.
Yeah, I just joined when this syphilis word came. So
yeah, okay. Okay, yeah, you thought that it was something important.
Yeah, something discussing.
Okay. Okay. Yes.
So thank you so much.
Okay. You're very welcome, girls.
And we are hoping next Saturday we will take another session.
I'll inshallah try to see what my schedule is and I'll share.
Yeah, please.
If not Saturday, would be someday.
Okay, please. We are waiting for your session.
Okay, inshallah.
Thank you.
It's Ramadan, and I'm trying to struggle with all my circuits, how to accommodate things. It will be with fasting and circuits and all that. I will have to be, and there's a course as well, of course, that I'll have to be a bit more energetic for that. Okay.
Okay, thank you so much.
Okay.
Thank you, ma'am.
Thank you. Sam, pray for us in Ramadan.
Very welcome. I will do, inshallah. I'm praying for everyone, Salma. Okay,
Thank you.
Assalamu alaikum.
Thank you so much, Sam. I was not active. I was quite busy.
No, I saw that you were busy. Yeah, I noted your
Thank
message.
you so much.
No worries. Okay. I hope it helped. Just that was
definitely. Yeah. Thank you.
Good. You take care. Okay. Bye, girls. Bye.